You know that feeling, right? When you're just run down and your body isn't fighting things off like usual.
Yeah, like that bug you normally shake off just hangs around.
Exactly.
Yeah.
Well, today we're kind of looking at something similar, but in our pets, it's a condition called neutropenia, and it can actually signal something more serious might be happening.
Right. In this deep dive, it's really about getting to grips with neutropenia in dogs and cats. We'll be looking at, what it is, what our sources say causes it, and why it matters so much for their health.
Okay.
And the info we've got digs into some specifics like genetic links in certain breeds, different triggers. It's
Good.
quite detailed.
So let's define it first. Neutropenia means fewer neutrophils, right? Those are the white blood cells that fight infection.
That's the core of it. For dogs, the threshold is generally below 3,000 neutrophils per microliter of blood.
And cats?
For cats, it's a bit lower, below 2,500 per microliter. And you're right, these neutrophils are absolutely crucial frontline defenders.
And this can happen alone, or sometimes it's part of a bigger picture, like pancytopenia.
Exactly. Pancytopenia is where all the blood cell types are low red cells, white cells, platelets. Neutropenia can be one feature of that, or it can occur by itself.
What I found really interesting right away was that some breeds just naturally have lower counts, like greyhounds.
Yes, greyhounds and also Belgian Tervuurens are mentioned in our sources.
Hmm.
They can have neutrophil counts that would be considered low in other breeds, but it's just normal for them.
So that immediately tells you it's not always a sign of illness, it's complex.
It really is. It highlights that baseline variation. You need to know what's normal for that specific animal or breed, if possible.
Okay, so let's get into how it happens. The sources seem to point to four main ways, or mechanisms. The first one sounds like a production issue. In the bone marrow.
Precisely. The bone marrow is the factory for blood cells, including neutrophils. So mechanism one is decreased production. The factory isn't making enough. Or maybe it's making them but not releasing them properly into circulation. A supply problem at the source.
Got it. Like a bottleneck. What's the second way?
The second involves where the neutrophils decide to hang out. Not all neutrophils are actively circulating in the blood that gets sampled. Some are stuck to the walls of small blood vessels that's called the marginating pool.
Ah, like they're on the sidelines.
Kind of, yeah. If too many neutrophils shift from the circulating pool into this marginating pool, the count in a blood test will look low, even if the total number in the body hasn't changed drastically.
So the cells are there, just not where we're measuring them easily. Okay, what's mechanism three?
This one is about increased demand. If there's a really severe infection or inflammation somewhere in the body, neutrophils rush out of the bloodstream and into the tissues to fight it.
Like reinforcements heading to the battlefront.
Exactly. And if that demand is overwhelming, it can deplete the number of neutrophils circulating in the blood faster than the bone marrow can replace them. Tissue consumption, basically.
Okay, production issues, shifting location, high demand.
Yeah.
What's the fourth?
The fourth is immune-mediated destruction. This is where the pet's own immune system mistakenly attacks and destroys its neutrophils, sort of like friendly fire.
Wow. So the system designed to protect is actually causing the problem.
It can happen. So those are the four main pathways: decreased production, shifting pools, increased use, or immune destruction. And any of them can lead to the same result: low circulating neutrophils.
Which, as you said, leaves the animal vulnerable.
Absolutely. That's the key clinical significance. Neutropenia makes dogs and cats much more prone to developing serious systemic infections because their primary bacterial defense is weakened. Bacteria, fungi, even some viruses can get a foothold more easily.
And these infections can pop up anywhere, right? Depending on where the pathogen takes hold.
That's right. It could be the lungs, the urinary tract, the bloodstream itself. Really depends on the situation.
Now, you mentioned genetic links earlier. This sounds fascinating. Can we dive into that?
Yes. The sources highlight some really specific inherited conditions. One is canine cyclic hematopoiesis. It's mainly seen in gray collies, though maybe border collies too.
Cyclic, meaning it comes and goes.
Exactly. It's an autosomal recessive trait, so they need the gene from both parents. It affects how a specific enzyme, neutrophil elastase, gets transported within the developing neutrophil. There's a problem with the delivery system, basically.
And what does that do to the dog?
It leads to these dramatic cycles, roughly every 12 to 14 days, where their neutrophil count plummets. And when it does, they get really sick: fever, diarrhea, inflamed gums, respiratory infections, swollen lymph nodes, even arthritis.
Oh, it sounds awful. Every 2 weeks?
Yeah, it's incredibly rough on them.
Yeah.
And sadly, the prognosis mentioned is quite poor. Many don't live much beyond a year. It really shows how critical these internal cell processes are.
Definitely. What other genetic factors are there? You mentioned Belgian interferons earlier.
Right? They can have an age-related neutropenia, seems to be genetic, but with what's called delayed penetrance, it doesn't show up until later in life.
And do they get sick like the collies?
Interestingly, the source material doesn't mention specific clinical signs associated with this interference. So it might be a lab finding without obvious illness, which is an important distinction.
That is interesting. A number doesn't always equal disease. What else?
There's also selective cobalamin malabsorption. Vitamin B12, or cobalamin, is vital for making blood cells.
Okay.
Some breeds have an inherited autosomal recessive inability to absorb B12 from their food. Our sources mention Emerslin-Grasbeck syndrome in border collies, linked to a specific gene mutation, CUBN.
So no B12 absorption means problems making neutrophils.
Exactly. It hinders the bone marrow's production line. And speaking of border collies, there's another one. Trapped neutrophil syndrome, or TNS, seen in Australian and New Zealand lines.
Trapped. What does that mean?
It's also autosomal recessive. In TNS, the bone marrow actually makes lots of neutrophil precursors, myeloid hyperplasia. But the mature neutrophils seem to get stuck. They don't get released properly into the blood.
So the factory's working, but the goods can't get out.
That's a good analogy. It's linked to a gene called VPS13B, similar to Cohen syndrome in humans. And these dogs, unfortunately, tend to suffer from recurring bacterial infections like bone infections, osteomyelitis, or gut inflammation, gastroenteritis.
These specific genetic examples are really powerful. They show just how precise neutrophil development needs to be.
Absolutely. Tiny glitches can have big consequences.
So beyond these really specific genetic diseases, are there other breeds vets just see neutropenia in more often, maybe linked to some of these factors?
Yes, the sources do mention others in terms of general risk or signalment. Schnauzers, Beagles, Australian Shepherds, and Sharpeyes are noted in connection with that inherited B12 malabsorption issue.
Okay, so that reinforces the B12 connection across multiple breeds.
It does. Rottweilers were also mentioned because of a reported deficiency in GCSF,
GCSF.
granulocyte colony stimulating factor. It's a hormone that tells the bone marrow, make more neutrophils, so a deficiency would lead to lower production.
Makes sense. And obviously the gray collies and Belgian interferons we already discussed would be on that list too.
Correct, because of their known specific issues.
So if a pet does have neutropenia, maybe from one of these causes or something else, what signs might an owner actually notice or a vet look for?
Often the signs can be frustratingly nonspecific, especially if the animal has developed sepsis, a bloodstream infection. You might see lethargy, just being really tired, and listless weakness, not wanting to eat.
Standard sick pet signs, basically.
Pretty much. Fever is possible, but, and this is really important, a normal temperature absolutely does not rule out a serious infection in a neutropenic animal. Their body might not be able to mount a fever response properly.
That's a critical point. What else?
Vets might notice signs related to sepsis or endotoxic shock, things like a really fast heart rate, very red or injected gums, maybe slow capillary refill time.
That's when you press on the gums and see how quickly the pink color returns.
Exactly. If it's slow, that's not good. Weak pulses can also be a sign. These point towards the body struggling with widespread infection and inflammation.
And we have to remember the specific signs in those gray collies, too. The cyclic fever, diarrhea, gum issues, breathing problems. That pattern is key for them.
Absolutely. That recurring pattern is a huge clue for cyclic hematopoiesis.
The source also mentioned a really unusual case, a dog with heat stroke developing neutropenia.
Yes, that was interesting. It showed neutropenia along with other blood changes, and even evidence suggesting neutrophils were dying off prematurely, likely due to the extreme stress of the heat stroke.
Wow, so severe physiological stress itself can impact neutrophil numbers and survival.
It appears so. Which leads us nicely into digging a bit deeper into the causes of insufficient neutrophil production. We touched on genetics, but what else stops the bone marrow factory?
Right. Infections seem like a big category.
Definitely. For both dogs and cats, parvoviruses are a major one. They hit the bone marrow hard. Certain bacterial infections can directly damage the marrow, that's myelonecrosis. And systemic fungal infections can also suppress production.
Any specifics for cats or dogs?
For cats, feline leukemia virus, and FIV, feline immunodeficiency virus, are notorious bone marrow suppressors. For dogs, tick-borne diseases like ehrlichiosis and babesiosis can reduce neutrophil output.
Okay, infections. What about, like, Medications or toxins.
That's another major category.
Yeah.
Certain chemotherapy drugs, unsurprisingly, can suppress the bone marrow. That's often an expected side effect. But some common drugs can too. Certain antibiotics, like cephalosporins, are mentioned for both species.
Really? Even antibiotics?
Yes, potentially. In cats, specific mentions include T2 mycotoxin from moldy food, the antibiotic chloramphenicol, some industrial chemicals like benzene ring compounds, and even drugs like methimazole for hyperthyroidism or the antifungal grisefolvin.
And for dogs?
For dogs, the list includes estrogen exposure, the anti-inflammatory phenylbutazone, the common antibiotic combination trimethoprim sulfatazine, and the anti-seizure drug phenobarbital.
That's quite a list. It really drives home how important a full medication history is when a vet sees neutropenia.
Absolutely crucial. You have to consider everything the animal might have been exposed to.
And we already talked about the lack of growth factors, like the inherited B12 issue. What else affects production?
Ionizing radiation is another one. Think of radiation therapy for cancer. It directly damages the rapidly dividing cells in the bone marrow.
Okay. And then there's this thing called myelophthisis. You mentioned it briefly.
Right, myelophthisis isn't a primary production problem, but rather the space in the bone marrow gets filled up or replaced by something else, crowding out the normal blood cell production.
Like what?
It could be scar tissue, which is myelofibrosis, or necrosis, dead tissue, cancer cells spreading to the marrow, disseminated neoplasia, or even widespread granulomatous inflammation from certain fungal infections like histo or crypto.
So the factory space itself is compromised.
Exactly. It's a secondary cause of reduced output.
Now, besides production problems, we talked about neutrophils leaving the blood. Can we explore that more? The shifting pools and tissue demand.
Sure. That shift from the circulating pool to the marginating pool, sticking to vessel walls, can happen acutely in conditions like endotoxemia. That's when bacterial toxins are in the blood, which can happen with infections like Bartonella or other severe bacterial sepsis.
So the cells are still there, just hiding out?
Temporarily, yes. Intense tissue demand is another big one. We mentioned infections caused by Rangelia vitalia as an example, where neutrophils flood into tissues, lowering the blood count initially. Even anaphylaxis, a severe allergic reaction, can cause a temporary shift, though that's less common.
Okay. And the last piece was reduced survival, right? Neutrophils dying off too quickly.
Yes. The most common reason for this is overwhelming bacterial infection, severe sepsis, pneumonia, peritonitis, pyothorax. The neutrophils are being used up and destroyed, fighting the infection faster than they can be replaced.
That makes intuitive sense.
Then there's the immune-mediated destruction we talked about, where the immune system attacks them. Certain drugs might also trigger direct destruction, not just suppress production. And conditions like hypersplenism, where an overactive spleen removes cells too quickly, can contribute.
And the heat stroke example fits here too. Direct cell death.
It seems so. Extreme stress causing premature death, oncotic, and apoptotic death were the terms used in that case study. So yeah, it's complex. Production, location, demand, and survival all play roles.
Okay, that's a lot of potential causes. So how does a vet actually figure out which one is going on? How is neutropenia diagnosed and investigated?
Well, the starting point is confirming the neutropenia itself. That's done with a complete blood count, a CBC, and specifically the leukocyte differential, which breaks down the types of white blood cells.
We might need more than one test.
Definitely. Especially if you suspect something cyclic, like in the gray collies, you'll need serial CBCs to see the pattern. Even otherwise, checking again confirms it's persistent, and not just a blip. A urinalysis with a culture is also really standard, looking for a UTI.
Good point. And you mentioned potential lab errors earlier. Sample handling.
Yes, that's crucial. Clotted samples, improper mixing, drawing from lines with fluids, these can all potentially mess up the count. So careful sample collection and handling are key.
Beyond the CBC, what other tests help find the cause?
It depends on what you suspect. Serology tests can look for antibodies or antigens from specific infectious culprits like FLV, FIV, or tick-borne diseases. If immune-mediated destruction is suspected, there are specialized tests for anti-neutrophil antibodies, though they aren't always straightforward.
What about finding hidden infections?
Blood cultures might be done if sepsis is suspected. Imaging x-rays, ultrasound is really useful for finding abscesses or localized infections, say, in the chest or abdomen.
And sometimes you need to look directly at the factory, the bone marrow.
Yes, a bone marrow aspirate or biopsy can be invaluable. It lets you see if the marrow is producing neutrophils properly, if maturation is normal, or if it's being crowded out by something abnormal, like cancer cells or inflammation, that myelophthisis we discussed.
And you mentioned being careful not to mistake recovery for leukemia.
Right. When the marrow kicks back into high gear during recovery, you can see a lot of young cells, which needs careful interpretation. Cytology, looking at cells from fluids or tissues, can also help identify infection sites or assess tissue demand.
And for those breeds with the B12 issue.
A therapeutic trial can be diagnostic. If you give B12 injections and the neutrophil count improves, that strongly supports inherited cobalamin malabsorption.
Mm.
Measuring blood cobalamin levels helps too.
Okay, so once you have a diagnosis, or at least you know the animal is neutropenic and at risk, what's the treatment approach?
The number one priority is managing or preventing infection. That's the immediate danger. So if a patient has neutropenia but isn't showing signs of fever or systemic illness, the approach might be prophylactic oral antibiotics. The sources suggest broad-spectrum ones that are hopefully less disruptive to the gut's normal bacteria.
Any examples?
Trimethoprim sulfadiazine, cephalexin, or enrofloxacin were mentioned, though there's a specific caution about higher doses of enrofloxacin potentially causing retinal issues in cats.
Okay, but what if the animal is febrile? That suggests an active infection is already underway.
Exactly. That situation requires more aggressive, typically inpatient treatment. Intravenous fluids for support and broad-spectrum intravenous antibiotics are usually the way to go.
Which antibiotics?
The goal is hitting both aerobic and anaerobic bacteria. Combinations like ampicillin or cefazolin may be paired with enrofloxacin again. Watching the cat dose are common starting points. Sometimes metronidazole or a different cephalosporin might be added for better anaerobic coverage if needed. Treatment continues until the infection is clearly under control and ideally the neutrophil count starts recovering.
You mentioned GCSF earlier, that growth factor. When does that come into play?
Recombinant human GCSF, rhGCSF, can be used short-term to give the bone marrow a boost, stimulating neutrophil production and release.
But there are downsides.
Yes, because it's a human protein, the animal's immune system can recognize it as foreign and develop antibodies after about, say, 10 to 14 days. These antibodies could potentially even cross-react with the animal's own natural GCSF. So it's typically only used for a few days during a critical period.
Gotcha. What about immune-mediated cases?
For those, suppressing the faulty immune response is key. Prednisolone, a corticosteroid, is often used for that purpose.
And you mentioned something about hydration with certain drugs.
Yes, particularly with sulfa drugs like trimethoprim sulfadiazine. Ensuring good hydration helps prevent potential side effects like crystal formation in the kidneys. Just a practical point.
So after treatment starts, what kind of follow-up is typical? How quickly do things change?
Well, if the neutropenia is due to chemotherapy, for instance, the lowest count the nadir usually hits around 7 to 10 days after the drug is given, but it varies. Regardless of the cause, monitoring with serial CBCs is essential to see if the neutrophil count is coming back up.
What are you looking for on those CBCs besides the neutrophil number?
You want to see signs of recovery. Ideally, the number of immature neutrophils that left shift should decrease. Any toxic changes seen in the neutrophils during severe infection should resolve, and you expect to see a rebound neutrophilia, a higher than normal count as the marrow recovers.
And if GCSF was used?
It's important to know that GCSF itself can cause a left shift. So seeing immature cells during therapy doesn't automatically mean the infection is worsening. You need to look at the whole clinical picture.
And the main complication to watch for throughout is?
Secondary infection. That remains the biggest risk until the neutrophil count returns to a safe level.
Okay, so wrapping this all up, neutropenia really is a significant flag, isn't it? It tells you something is wrong, even if it takes detective work to find out what.
Absolutely. It's a sign that the body's defenses are compromised, stemming from a huge range of possible issues. Genetics, infections, drugs, toxins, marrow problems, you name it. Veterinary investigation is key.
We covered some really fascinating details of the cyclic nature in gray collies, those specific gene mutations affecting B12 absorption or neutrophil release in border collies, the age-related aspect in tervirens.
And the sheer variety of triggers, two common viruses like parvo, everyday antibiotics, even severe stress like heat stroke, it really underscores the complexity.
It does. This has been incredibly insightful and makes you appreciate how finely tuned the immune system is and how many things can, well, throw a wrench in the works. It leaves me wondering, for our own pets, what other maybe subtle changes in their health or behavior might deserve a closer look, a chat with the vet.
That's a great takeaway thought. Being observant and proactive about those seemingly small changes can make a big difference in catching problems early.